So tonight's webinar is going to be led by Jen Craven. Jen had a long and distinguished career as a nurse, both in the UK and Canada. And then she decided to devote the rest of her career to passing on her knowledge and skills to train as many people as she can in first aid. So Jen, I'm going to hand over to you. Because of our few technical hitches, I'm going to be Jen's presenter, so she will tell me when she wants the slides to slide,
We're
and then
doing a
she'll be able to talk you through. So
COVID
welcome, Jen. I'm handing over to you.
Okay, thank you very much. Yeah, thank you for joining. Thank you, Tina, for that lovely introduction. So I'm going to run through all the steps. We're going to flick over to the first slide, if that's okay, just so we can look at what we're going to cover. I think what Tina has really wanted me to sort of get across to you is we're just going to look at a few sort of little details around choking, a few facts and figures. We'll just highlight really the key choking hazards. Some of them you'll all be very familiar with, but again, it's always good to do that quick review of that sort of information. Also, we're just going to mention a little bit around the Eat Safe campaign as well. Now, I know here tonight there's a variety of people from different backgrounds. Some of you are working in the early years settings, others maybe parents. So again, it's how this applies may be a little bit different, but again, it's just good for everybody, whether you're a parent, you are working in early years, just to sort of, just to mention this so we're all sort of reading from the same page. Also, obviously, one of the most important things we're going to look at is how we're going to help if you have an infant or a small child who is choking. So we're going to look at all of that. Once I've gone through that information, I think we really want to wait till the end to do some questions, and I'll do my very best to answer everything I can do. Yes, I hope that's okay. Okay. Now, I know just from experience of teaching lots and lots of different people in different settings, schools and nurseries, and also parents who are obviously looking to make sure they can keep their little ones safe. Choking is such a huge topic for so many people. And we do know that there are, children die, well, I mean, almost every month in the UK from choking, and and hopefully, this is why we have people doing first aid so that we can prevent these type of things from happening. I use the word prevention, so again, that's what our Eat Safe campaign is about. It's going to help people, manage situations properly, but in the event of something happening, like somebody does start to choke, then having the skills and the knowledge to help is invaluable. One of the things that we are highlighting as well, there have been some very, very high profile deaths over the years. And when you look at things like coroner's reports, now, I don't expect you all to be reviewing coroner's reports. That's the sort of thing I do. Yeah, I know, a bit bizarre. But it does highlight, where failings have happened, sort of the food preparation wasn't appropriate for the age of the child, so obviously the stage and the age of the child in their eating program, lack of supervision at meal times. Again, it's such an easy thing to happen. And then also, if somebody doesn't really know what they're doing, they don't know how to manage a choking child or an infant, or they just haven't had any first aid training. So again, we know this is all the sorts of things that unfortunately lead on to the problems that we see. Now, there have been some changes in the early years framework that, again, as we're mentioning, they're looking at trying to give more guidance and guidelines so that we can help to avoid these situations happening. And this has really stemmed from the death of a lovely little boy called Oliver Steeper. And I'm sure quite a few of you might have seen this in the press. And he had died in a nursery when he'd eaten something that wasn't really appropriate for him. And he had choked and very, very sadly died. So incredibly sad. So, it's this sort of stuff that we want to look at. And it says here about, dietary requirements. I mean, when your child joins a school or a nursery, it's so important there is that communication between the parents and the staff in the nursery, in the school, so that they understand, what your child's dietary requirements are. Have they got allergies? That's always a huge one. Any health needs. So, nurseries and schools, they are, obliged to make sure they can keep children safe in any of these settings. So again, and this Eat Safe campaign is looking to help with that. I think it's the best description. I think I just want to say this. I think it's rather sad that these sort of campaigns stem from situations like a small child dies. I always think about Natasha Ednan-Laperouse, who died from eating the Pret a Manger sandwich, and then obviously Natasha's law came out after that. So it's rather sad that we have to have these events happen. and then we start putting in new policies in place. I know Tina has been amazing at putting some resources available, and I understand that a lot of these resources from the Oliver Stipo website will be sent on to you. So you'll have links to all sorts of information, which is fantastic. All right, let's have a look. Yeah, this is just a little bit of detail on the eat safe settings. As it's a new addition to the early years framework, safer eating section. And again, it's just trying to help staff in nurseries and in primary schools to help keep children safe. I think one of the key changes that has come about is that when a child is eating in any of those settings, that somebody has to be fully pediatric trained on site, to monitor that situation. Also, nominating somebody to actually look after food safety checks, making sure that everything is done, appropriately for the age of the child. Also about, making sure we've got good communication, and it says, active discussions between parents, health professionals, on what stage a child is at in their weaning program, and making sure that the food is appropriate, it's the right textures, the right size, the right consistency, all of those sorts of things. Also, if something does happen, hopefully nothing too serious, but again, look at what happened. I think when I look at situations that, we've dealt with, and it doesn't have to be choking I'm referring to here, it could be any sort of incident, something's happened, we've managed a situation. How did it go? What went well? What didn't go so well? What could we do to improve? So I think that's super important in anything we do, especially as a health professional. How did it go, and can we improve this? So, if something happens again, we've actually evaluated the action we took. And can we improve on that? So I think that is something else that should be happening. And also, obviously, when the children are eating, they're in a safe environment. There's not lots of stimulation. They're in the appropriate seating, the appropriate position. All of these things are all part of this guidance, which I think will be very, very valuable. Now, just moving along to this. Common choking hazards. Yes. Okay, if I was on a course teaching anybody, I always say, what do you think is the most common cause of choking in smaller children? And the first thing we get is grapes. Yeah, I agree. Grapes, they're perfect. Shape, size, cherry tomatoes, absolutely. I think they are so vilified for lots of reasons. That people are very aware of them, and they are, schools, nurseries, parents, very careful cutting everything lengthways into quarters. And interestingly, things like sausages and hot dogs, absolutely up there in that list, really quite hazardous. So we have to ensure that they are appropriately prepared so that to minimize the risk of a small child choking. And you can see there lots and lots of other ones, nuts and seeds and sticky foods, boiled sweets. I almost choked on a boiled sweet, just slid down the back. I looked around Boots and thought, gosh, I hope somebody's here to help me. And then luckily I swallowed it and it all went well. So again, but it is quite a scary experience. Also jelly cubes, that is something that where I am in my local area, we did have a little child who actually choked on a jelly cube and very, very sadly did die from that jelly cube. We also had a child choke on a grape. This was at home. And again, sadly, it didn't go very well. So, we've really got to be very aware of these choking hazards. Don't always have to be food. It could be something else. It says that coins, I know coins used to be a very, very high choking hazard. And I can speak from experience on this because I've got 4 children and my husband would come home, empty his pockets, coins would roll out all over the floor. And as you know, children, especially little ones crawling around, they pick something up, stick it in their mouth. And a coin, is a perfect size. Well, depends what size, depends what it is, 1p, 2p. I can't even remember what they look like now. But those were really high hazards. Less so now because we're so cashless. Small toys, yeah, absolutely. I remember my children were little, there was things called Polly Pockets. They had little dresses and little rubbery clothes you could put on little dollies about this big. Perfect. Stick them in the mouth. And again, a huge choking hazard. So we are incredibly careful about those sorts of things. Batteries, yeah, especially the alkaline batteries, we are all very, very aware how dangerous they are as well. So these are just some of the key choking hazards that we like to highlight. I can say as well, there's probably lots and lots of other things. Stones, leaves, stickers, dirt, all sorts of things get put in the mouth, especially when children are very young. So we have to be incredibly careful. Now, just want to move on to this a little bit. If there is a choking situation, again, if we've got a child well supervised, hopefully, as soon as we spot a problem, we can step in and do something. And again, with like any emergency, the quicker we actually step into that situation and start to assist, the better the outcome, which is why it's so important that, you know, these small children are so well supervised whilst they're eating, so they can be quickly spotted and we can step in. Now, I can't see where, can you, I've got a bit missing here. It should say mild choking. Tina, can you see that? There's no bit on mild choking.
Jen, I'm so sorry. I think it's cut off of here. So yes, so you need to just.
Yes, yeah, don't worry, that's fine. I got that. What it should say on that slide to the left, it should say milder choking, and then on the right, it talks about severe choking. Now, mild choking, again, it's not. It doesn't look great, but again, if it's milder choking, you know, a small child, an infant, you know, hopefully if they've just got a mild choking episode, they can actually cough and splutter and gag and make all sorts of noises. You know, they can probably cough, and it sounds dreadful, and it's quite terrifying to watch your own child or somebody else's small child looking like that, coughing and spluttering, maybe drooling, eyes looking all distressed. You know, and again, but if they're coughing, they can move some air, they can make noises. Hopefully that is just a milder choking episode, and we can just, you know, stay with that child and assist them to continue to cough, and hopefully they will just manage to be able to clear their own airway. That's the goal. So the coughing, the noises, the moving air, making sounds, that's all good. That's good. It's better than one on the other side where we're looking at severe choking. Severe choking, as we know, is quite deadly. We need to see that, and we need to step into that situation immediately, as quick as we can. If somebody, a small child, baby, they're struggling to cough, okay, or the cough is really ineffective, they are quite silent. You know, they probably can't make any sounds. Maybe they can't even cry. Again, they might just be staring, okay? A baby, a small child who's just sitting in a high chair might just be looking, staring, and really not fully understanding what's happening to them. Slightly older child may have more of a sense of, you know, have that cognitive capacity to have an appreciation of what's happening. So they might be looking and possibly even trying to indicate, you know, maybe grabbing at their necks a little bit, but they're struggling to make sounds, struggling to cough, struggling to move any air. Okay, they tend to flush the skin tends to flush initially when somebody starts to choke. If we don't do something about it, then they're going to start, their colour is going to start to drain away. They're going to look paler, clammier, starting to get maybe sort of a blue tinge around the face. So again, we don't want to get to that point. We want to step in as soon as possible. Okay. Now, just looking at this, now I will demonstrate this in a minute. I'm just going to talk through it first. Most importantly, I think we've got to immediately recognise that child. If they're sitting in a high chair, you know, I would pick them out of the high chair, or, you know, and get next to them, sit next to them if they're in a chair or wherever they are, and try and encourage them to cough, okay? Immediately get the coughing. If they can't cough, or the cough doesn't seem to be effective, okay, then we need to start, you know, taking the next step, which means we'd be moving on to doing back blows. When it comes to choking, we talk about doing back blows, and we talk about doing up to about 5 back blows, okay? Now, at this point of venturing down that pathway, ideally, somebody is now starting to think ambulances are going to need to be called, okay? So if somebody's having severe choking, do think to get an ambulance, because if you can't clear their airway, you will be so appreciative that that ambulance is on its way to get there to help you as quick as they can, okay? And I'm going to demonstrate back blows in a minute, all right? So you're going to get that child. If it's an infant, we're going to be putting them across our knee or across your arm, and you're going to try and you're going to hit them around 5 times right between the shoulder blades, okay? And I will demonstrate this in a moment. The back blows, really what we're trying to get to do, we're trying to get a little bit of vibration running through the child's chest. We're trying to loosen that object, because if we can do that, we can try and get that child to start coughing. And if they can cough, then that is just a fantastically positive step forward, okay? Now, if that hasn't worked, then we're stepping on to the next level, which is quite a serious step. We're talking about moving to abdominal thrusts. Now, abdominal thrusts, we're only going to be doing these on a child who is over the age of 1. Okay, all the guidelines that we practice and we teach about are set by the Resuscitation Council, and they are the advice is, the guidelines are, we cannot be doing abdominal thrusts on an infant. So we'll talk about that in a moment. But you could do an abdominal thrust on children over the age of 1. I would say, though, obviously abdominal thrusts, this is quite a powerful action. It could cause damage. So, we do need to be cognizant of that as well. All right. So we would start with the coughing. Okay. We then move to the 5 back blows. If that has not worked, we're moving to 5 abdominal thrusts. And as I said earlier, if it's severe choking and the child is unable to cough, or it's just not effective, and you are getting to that child to start back blows, hopefully somebody's right there with you to start calling ambulances. All right. Very important. We think about getting those ambulances as soon as we can. All right. If the first round of 5 back blows hasn't worked, you move to your abdominal thrust. If that has not worked, we're then going to go and we're going to repeat the 5 back blows and then the 5 abdominal thrusts. So we're going to be working through in cycles of 5. Okay. Now, I am very, very hopeful that a few back blows and everything is fine. If not, we have to keep repeating the cycles. Okay. If it is not successful and we cannot clear the airway, you are going to end up with a child who is going to start to collapse. They will become floppy. And at that point, we're now into a different situation. We do need to get that child down onto the floor, onto a safe surface, and we then need to check their airways and check if they're breathing. Now, if a child isn't breathing, okay, or isn't breathing normally, that means we're now going to have to start CPR on that child, okay? And that's just a terrifying experience for so many people, but it's so important because we now have moved from a choking child to a child who is no longer breathing. Therefore, we have to then follow the steps to resuscitate a child. Okay, we're talking about starting with some rescue breaths, 5 rescue breaths, then moving to compressions and more breaths. So that full CPR cycle. All right. And again, I'm going to be demonstrating not CPR, I'll be demonstrating the choking steps in a moment. Now, as I said, this sequence is something we're talking about for children over the age of 1. If we are looking at babies, slightly different. Now, infants, okay, wherever your infant is, I mean, they could be sitting in a car seat. Maybe they've picked something up off the floor and they've stuffed it in their mouth, or they're in a high chair. So again, look at that infant. If you can see a baby, then again, their skin is flushing red, their googly eyes looking a bit like that. Okay, now an infant's not going to be signaling or anything like that. All right, so you're going to get in there, you're going to have to pick that child up. Now, I would say to anybody, always have a quick look in the mouth. Is there anything you can see? Maybe something is hanging out of the mouth. Maybe you could easily pull something out. One of the key things to remember is that even if you can see something and it's sticking further back in that child or that baby's mouth, please do not get in there and start fishing for that object, okay? The risk is when you do something like that, which would be, I think a lot of people's instinct would be to get your fingers in and try to reach something and pull it out. Okay, I'm not going to say I've got fat, chubby fingers, but you know what? That in a child's mouth, pretty dangerous. Potentially, we could push something further back, and that will potentially make the situation a lot worse. I will just mention briefly that this happened to me when I was 2.5. No recollection at all, obviously. I choked on a toy key. My mum was a midwife and a nurse. Had no first aid experience, obviously. She got her fingers straight down the back of my throat and started trying to reach the key. She suitably informed me, apparently, when I was an adult, that I was absolutely purple, but she kept trying. She then decided the best option for her was to get my father's penknife and do a quick tracheostomy on me. Yippee! I know. Don't worry, she didn't do it. Thank goodness. She had one more go with her fingers, had a quick poke at the back of my throat, and luckily she dislodged it and I swallowed the key. The rest is history. It came out about 5 days later, apparently. Great stuff. So please do not do what my mother did, okay? All right, so that infant, if they're looking like that, you're going to get that infant out. Quick check. Can you see anything you can retrieve safely? If not, please do not dangle your children by their ankles, okay? That can be quite dangerous. I know lots of people have done it. I have had so many times I've been told, oh, my dad grabbed my brother and he picked him up like that. They're obviously all from Yorkshire as well, by the sounds of it. Sorry about that. But please don't, okay? This is not appropriate. Yes, gravity is great. It will be helpful. So get that infant across your knee. Same with a small child. You'll put the small child across your knee and you're going to aim to hit them right between the shoulder blades. Right between the shoulder blades, again, trying to loosen that object so the child can start to cough. If that hasn't worked, We're going to turn that infant over, really holding them securely. You're going to then aim to sort of line up with the nipples. That's quite a good landmark. And you're going to aim to actually get your fingers right on the middle of that chest, okay, where you'd probably be doing compressions, and you're trying to do a chest thrust. You're pushing forward, trying to force some air out of the lungs, okay? And I'm going to be talking through this and showing you exactly how to do that, okay? So your back blows, okay, are trying to loosen the object just by creating a bit of vibration through the chest, so hopefully the child or the baby can start to cough. Okay, the abdominal thrusts, right, and I'm going to demonstrate that as well. That we're positioning our fist in the just above the belly button, and I will show you. So you can pull your fist back hard and fast and pull up a little bit. It's a little bit of a curve up. What you're trying to do is to push up under the rib cage, and that sheet of muscle, your diaphragm, okay, that will help to push some pressure up in the chest and hopefully force some air out of the child's lungs, okay? And that hopefully will help to dislodge the object so that the child can start to cough. With the baby, when you're doing a chest thrust, again, you're trying to force some air out of the baby's lungs to dislodge the object. And hopefully that can get that child coughing, okay? Or just vomiting even, that will help, all right? So same with the baby, please, whether it's a child or a baby, you start by quick checks, start with your back blows. If that hasn't worked, move to your chest thrusts, same approach there again. So 5 back blows, 5 chest thrusts. If it hasn't worked, okay, ambulances have been called, right, and you're going to keep running through those cycles. 5 back blows, 5 chest thrusts, 5 back blows and 5 chest thrusts. You're just going to keep moving through that until either the infant clears the airway, okay, in which case you're then going to have an ambulance there to come in and look after you and take you in, or you're going to end up with a floppy infant. If that does happen, once again, we would then be putting that infant onto a safe surface, checking if they're breathing, and if they're not, we're into full CPR, please, okay? Just to speak to something a minute, I know when I talk about doing CPR, we talk about giving rescue breaths, and in children, we do just need to be giving rescue breaths. There's always lots of questions around, well, we can't give rescue breaths if they've choked because, you know, I won't be able to get air into my child's lungs, or what if I push that object down? Sadly, we do have to attempt to give the rescue breaths. You know, these children, they haven't got oxygen. They need to be given some air, which has about 16% oxygen in it. So we do need to attempt to give the rescue breaths, right? You might get air past the object. You might move it down a bit, which I know sounds terrifying, but now we're into the fact that we're just trying to do good quality CPR. So again, if that does happen, please don't worry. You've just got to attempt the very best CPR that you can do. I am very hopeful you will not have to do that, of course. We will clear airways. That's the goal, okay?
We tell everybody that if they've got a pillow or a teddy, they should grab that now.
Yep, that works for me. Okay, right. So here's my infant, okay? He is lovely little baby Barry. He's having a severe choking episode. So I've got my infant out of a high chair, a buggy, whatever the situation might be, maybe off a play mat. I always had a quick look. Can I see anything in that child's mouth? Is there anything I could easily retrieve? But as I said, please do not start fishing at the back of a child's mouth or throat. We could actually just, you know, push something further back and very much make the situation worse. If something's sitting further back, the hope is that the next step that you do, as in putting your child across the knee and doing some back blows, that should get something to dislodge and hopefully fire forward, which is what we want to happen. So this infant, okay, so I'm going to take this child. Now, if they're bigger, they're going to, you know, I mean, if they're small, you might be able to pop them across your arm like that. Make sure the head is going towards the floor, okay? If they're a bit bigger and they're not going to fit on your arm, I would say just pop them across your knee, okay? Make sure the child is securely held, all right? And we're going to hit with an open hand, please. Don't go in with your fists, okay? Open hands. And we're going to try and hit this baby right between the shoulder blades, okay? Trying to create that vibration through the chest to hopefully loosen the object. So I'm going to get my hand like this, open hand, and I'm going to hit this baby. Hit once, and I'm just going to quickly check to see if anything's happened. If not, I'm going to hit again and check. And 3, and check again. 4, check again. And 5, and check again. Now, hopefully that has been effective, okay? And great, job done. If it's not worked, we're now going to have to turn that baby over, make sure they're securely held, right? Again, get their head towards the floor. A little bit of gravity can assist with the process. So get the infant towards the floor, securely held on your knee, or you might be kneeling on the floor, wherever you are. Just try and get to the middle of that chest. I mean, generally sort of lining up with the baby's nipples. You might have to open clothing. 2 fingers, not from up here, by the way. Find that position, and you're going to push on the infant's chest, okay? Pushing some air out of their lungs. So push once, okay? If it doesn't work, push again. 2, 3, 4, and 5. If something starts to come up, you can quickly pop that infant over, okay? And hopefully something's in the mouth and you can catch it, all right? If that hasn't worked, all right, we're back to the back blows. Hit once, twice, 3 times, 4, keep checking, and 5, all right? Hasn't worked, back to the chest thrust. Okay, so push and push and push and push. So we're going to do 5 of those. So you may have to keep repeating those cycles. 5 back blows, 5 chest thrusts, 5 back blows and chest thrusts. Okay, so keep repeating your cycles until it either clears, or you might just find yourself ending up with a very floppy infant, which you do not want to happen. Okay, so infant, right, we're doing chest thrusts, not abdominal thrusts. Children this age are too small. You could cause damage if you do abdominal thrusts on a baby. So I would say, definitely not on this age group. Over 1s, yes, we can do that. But again, if they're little, I would be very aware of the age of the child. If they're very small, okay, doing abdominal thrusts potentially can cause damage to the child. So anybody, whether it's an adult, a child, if they've had any abdominal thrusts, they need to be seen by a health professional, okay? Ambulances should have been called, but either way, they need to be seen by a health professional just to make sure there isn't any damage. And, it's a precautionary measure. Now, this is, I call him Medium Barry. Now, he's wearing this lovely bright red outfit. This is a choking vest. Just to, anybody working in nurseries, you'll know you don't need this if a child is starting to choke. But sometimes I have had a couple of people ask me, so if somebody's choking, do I have to get one of these vests and put it on them? No, you don't. This is just to help me demonstrate, okay? Now, this child is older. So again, I'm going to quickly look. I'm going to check with the child. I'm going to talk to them and say, Barry, you okay? You choking? Now, if the child says, yes, excellent. If they're just looking at me, buggly eyes, trying to make noises, trying to breathe, trying to cough, but there's nothing coming out, I'm going to encourage them to cough. Can you try coughing for me, Barry? Come on, try coughing. Give it a go. Come on, I can't see. Come on, if you cough, hopefully something's going to come out. Now, if that's a struggle, it's not being effective. We're now going to take this small child, and if they're small enough, you can put them across your knee to make sure they're well supported. You don't want to hit somebody on the back and they go, wah, flying over there. So please make sure they're either well supported across the chest or, sorry, Barry, you've put them across your knee, right? And you're going to hit them again, a bit like the infant, head towards the floor around 5 times, right between the shoulder blades. Okay, so hit once, again, check again, 2, check again, 3, check again, 4, and 5. Okay, so we're trying to hit right between those shoulder blades, okay, to try and get that child to hopefully start to cough. If that hasn't worked, we're now stepping onto the next stage. Now, the age of the child, how big they are, how small they are, all sorts of things. You might have the child sitting on your knee. You might be kneeling behind them. What you need to do now, again, ambulances should have been called, okay? If you're progressing on this pathway, we should have had an ambulance on the way at this point. You're going to stand behind, kneel behind that child, okay? You need to landmark approximately where their belly button is, okay? And on this vest, this is meant to be the belly button, okay? Just to be quite clear. So landmark approximately where the belly button is. You're going to put your arms underneath the child's arms. Barry hasn't got any, okay? That's okay. So run. I would use my non-dominant hand, okay? Now I'm right-handed, so I've got my left hand here. I'm making a really good solid fist. I'm going to get my fist and I'm going to roll it just above that belly button, okay? Now, I always say to people, put your thumb outside, not grip your thumb like that, because you might hurt yourself. Thumb on the outside, and you want your thumb rolled onto the belly, okay? Get that lined up a bit, sorry. There we go. So you want your thumb rolled up onto the belly. Now, your fist is just above the belly button. Now, the rib cage is obviously up here, and the lower rib underneath there is where the diaphragm is. You're going to get your dominant hand, bring it round, and you're going to grip your fist here, and you're going to pull back on your fist, and you're going to guide your fist back and up a little bit, try and get that push up So hopefully you can increase the pressure in the chest, force some air up and out. Okay, now I'll show you on Barry here. Okay, so you're ready for this, Barry. Brace yourself. Okay, 1, 2, 3. Oh, oh, did you see that fly out? Took 2. So that's what we're trying to do. Sorry, just going to grab my projectile. Okay, so obviously for those who had done first aid courses, you've probably seen these choking vests. It just helps us teach this, all right? So again, just to show you, it's a bit big for Barry. Okay, find approximately where that belly button is. Roll your fist into this position here. Okay, you're going to just get your hands in that position and you're going to try and pull back. Okay, Barry, I'm just going to push in your belly. Okay, 1, 2, 3. Okay, and hopefully that is shot over by the biscuit tin. Excellent. Now, again, if it wasn't working, I would then repeat that 5 times. Then I'd go back to the back blows. Okay, head towards the floor. Repeat your back blows. That's not working. You go back to the abdominal thrust and you keep repeating those cycles until it's either cleared or your child is going to run out of air, oxygen, and they're going to become floppy and collapse, in which case you need to assess them and check their breathing. And if they're not, we're into full CPR, please. Okay. Does that all make sense? I hope.
If anyone's practicing at home, I said we would do questions at the end, but if anyone's practicing at home and they've got a question about this particular part of the webinar, do you want to ask? There was one question I'm just going to share with you. Anna asked, is it better for the child to be sitting or standing up? Jen, is it better to be sitting or standing up if you're with, let's say a toddler, an early years, under 5? Because I think that this is something that comes up a lot in training, that if you've got a baby, it's fairly clear that you're going to hold it along your arm or over your knees. Let's say you've got a 4 or 5-year-old. What do you suggest then? Still over the knee?
Well, I think I always say if they're small enough, put them across your knee because they're well supported. Okay, they're not gonna, you're not gonna knock them to the floor if you hit them hard on the back. Get them across your knee. If they're small enough to go across your knee, and I think you probably a 3, 4, 5-year-old again, you could easily put those across your knee. Once they're starting to get a little bit bigger than that, I mean, there's nothing wrong with sitting them on your knee and reaching behind, kneeling behind them. I don't think, in my mind, there's not any benefit to say you should do it this way or that way. Okay, I think if you've got to find your position. It's like anything, sometimes you have to adapt. But I think if you're kneeling behind them, they're sitting on your knee, they're across your knee, whichever it is, and doing abdominal thrusts, you're going to have to sit them on your knee or kneel behind them. You're just going to find your position. But I mean, children are all different shapes and sizes. You might get a tiddly 6-year-old who will go nicely across your knee. You might get a bit of a whopper, that you can't, in which case adapt. Again, these are guidelines. There's no hard and fast rules about what position the child is based on their age. I think you just need to look at the child and make that decision in the moment.
Yeah, which is obviously difficult. So Jen, actually somebody else has said the same. If you had a very small child over 1 or a much bigger child than average under 1, in terms of doing the chest thrusts or the abdominal thrusts, is that again determined by the size of the child rather than the age?
Yeah, no, and it is so important. I mean, these are guidelines, aren't they, that we're given, up to age 1. I mean, you might get a child that was prematurely born. You might get a child who was small for dates, So again, I think I always say to people, try and keep to the guidelines. But then somebody will say, what if I've got a child who's 13 months? Oh, yeah, so that's just such a grey area, isn't it? I think from that point of view, look at the size of the child. I mean, that age, they're still really small. If they're small, I would go to the chest thrusts. Okay, if you think they're not being effective, I think sometimes people might decide, well, okay, I'm going to try an abdominal thrust. But abdominal thrusts are very powerful. I would say caution when you do an abdominal thrust on a small child. We want to clear an airway. That is important. That's critical. But you don't want to cause any unnecessary damage to that child either. So I think on balance, I think you need to look at the size of the child and just make the decision based on their size. If they're small, maybe err on the side of caution, try the chest thrust. If it's not working, you might progress up.
Okay, and there's one more question before we move on, which is, I've seen some people offering water to a choking child. What would you recommend?
Define the type of choking we've got here. Sometimes people get little bits of, we've all had it happen. You get a little bit of something stuck in your throat. And you can feel it there. as long as they're air, they can, they can move air, they can make noises. I mean, sometimes a little, and it's not severe choking. You're not going to do that for severe choking, but give them a little sip of water. Sometimes it might just help to flush something down. And again, that is okay. But this is on a child who's not severely choking. They're having a little bit of a cough and a splutter. But again, if it's severe, you've got to step in immediately. This is not time to be getting cups of water and things like that. So just to be smart.
Thank you, Jen. So a lot of nurseries and a lot of parents ask about choking devices. Now, the LifeVac is the one that has been approved for use in the UK as a Class 1 medical device. You can read on the screen what it says, which is that the Resuscitation Council UK, which is the organisation that sets the guidelines for all resuscitation, including choking guidelines in the UK, and they are the guidelines that the NHS follows, that all medical professionals and first aiders follow. And when we teach, we must teach in line with their guidelines. Now, what they currently say is that there isn't enough evidence to support the safety or effectiveness of these devices compared to the standard techniques that Jen's just shown you of back blows and either abdominal thrusts or chest thrusts for an under 1-year-old. But they are also very open to more research being done, high quality clinical research being done to really establish whether these devices should be part of the protocol. Now, Jen and I have both seen the device being demonstrated. We've both met the UK distributor, and I think that we would both say that watch this space. Let's hope that they can get the clinical evidence together to make a decision, because if this is this might be a really valuable tool. And it may be that in the future these are recommended as part of the choking protocol. But at the moment, as a training company and as training first aid trainers, we can't endorse them. What I would say, Jen, I think you'd agree, is that if you've got one in your setting or your home and you have a choking incident with a baby or child, or an adult, in fact, start immediately, encourage them to cough, back blows, chest or abdominal thrusts. It's really important that you do that because time is of the essence. So you need to start with what is proven to work for choking. Now, if there is a device, get somebody to bring it. If you've tried everything and it's not working, I would say that I would definitely try that device, but not as your first port of call. I think it's really important that you follow the tried and trusted protocols first, and then if you've got that device, use it. By this time, somebody will be on the phone to the ambulance anyway, or if you're on your own, make sure that you've got your phone on speakerphone. They may say, you can say to them, I've got this device, shall I use it? They'll advise you in real time on what they think you should do. And actually, Lauren has made a comment here. Lauren has said, we've got a LifeVac. It's been made clear we only use it as a last resort after trying everything else. Yeah. And Colleen, you've said, I have a LifeVac at my setting, had to use it for the first time a few weeks ago on my own child. I did the back blows first. So that's really interesting. I do think that these devices are becoming more and more popular. And I worry a little bit because on social media, I see I see them being really, really pushed to make sales, and I'm all for anything that's going to improve the outcome for a choking baby, child, adult. I just want to say, in the first instance, please follow the coughing, back blows, chest or abdominal thrusts, and then that device somebody should have been able to go and fetch that if you've got one for use if everything else has failed.
Yeah. And I think the Resuscitation Council is, as Tina's quite clearly said, they are concerned that people do go straight to the device and they don't follow the protocols. And it is so important because any sort of medical action or device or drug, they've all been through research, clinical trials. So we are teaching and practicing, actions that are evidence-based, and it's so important. And I totally agree with Tina. I mean, we've put the button there, watch this space. Yeah, it might get legs, and I think there may be a place for it. But as Tina said, we can't really be teaching this until we've got that full approval. And I always think it looks a bit like a toilet plunger. So
Yeah, well, I mean, that's kind of
yeah,
the theory behind it, and toilet plungers work. So,
yeah, I think as I said before, if you're in severe choking, you're calling ambulances as quick as you can. If you've maybe just done some back blows, and the chat, everybody seems fine, but sometimes people can feel like there's something still there, maybe a little bit of difficulty swallowing, anything like that. And if somebody feels like there's something just stuck, they need to get seen, just to make sure that if there is something there, it can be retrieved safely by staff in the hospital setting. Okay, any abdominal thrusts. I know there are situations, and I've had so many times this has happened, where somebody's been in a restaurant, for example, and somebody's choked, somebody's leapt in, the old Mrs. Doubtfire approach, leaping across tables, and they've done a couple of abdominal thrusts, and nobody has called an ambulance. The person appears fine, but if you're acting in that capacity as the person rescuing, or in a first aid, you're acting as a first aider, that person should be advised, please take this child to hospital and get them seen. Or if it's an adult, you need to get seen, okay? Because there could be some damage, and we just need to make sure that everybody is okay after they've had a choking episode. So yeah, abdominal thrust, people need to be seen, please. Absolutely.
okay, so that's the end of of what we wanted to cover. Are there any other questions before I just sort of wrap up something that I wanted to say? Have we answered everything? Yeah. Okay, I think that we have. So, Jen, thank you ever so much. Oh, hold on a second. This is a really great question. How do you deal with the panic that may set in? And I'd say the panic that will set in when you have a choking incident. And Jen?
This is where knowledge is power, isn't it? That is not an easy answer, no easy answer to that. I think when we are working with people in clinical settings, teaching courses, we do talk about human factors. And I said this afternoon with somebody, how you respond in an emergency. Really, you won't actually know how you're going to respond, and whether you're somebody who might panic or somebody who'll just go absolutely calm. I always say to people, take a deep breath. If you've done some learning, you've had some practice, just feel that confidence that you can actually manage that. Just take a couple of breaths and just try and think what you've got to do. I think with children as well, it's so important that we try not to panic. And even with an adult, if somebody's running around and screaming and panicking, that person who is in trouble it could escalate the situation. Very difficult to say, try and stay calm. Some people will just stay very calm. Some people will not stay so calm. But if you've done some learning and some practice, that definitely will help in terms of helping you to cope with that situation and hopefully manage it successfully. So it's hard to answer.
I think that's a great answer. And actually, the way to deal with the thing I just want to add is, and this is something that I really feel very, very strongly about, the requirement for pediatric first aid is that you do your training once every 3 years. Now, lots of settings will do updates in between, which is fantastic. But I think that from other examples in your life, you'll know that practice makes perfect, and that the more you practice something, or the more you review something, the more likely it is to come back to you in a panic situation. So what I'm trying to get off the ground is for all nurses to sign up for their staff to once a month watch a 3-minute free video, just to have that knowledge reinforced, so that in a situation it comes back to them quickly. And that way you'll have the panic, you'll take some deep breaths, you'll work as a team in your early years setting, and that information, those basic cough, back blows, chest thrusts, abdominal thrust, yes, abdominal thrust, chest thrusts. That's all you've really got to remember. And I'm very happy to say, I will send a follow-up. If you want to have that video so that your staff can watch that, please let me know. That's how I think that you deal with panic, by making sure that you're so well rehearsed, so practiced as a team in your setting, so that you know that if you're in a room with children, okay, a child starts to choke, somebody's got to do the first aid, somebody has got to make sure the emergency service is called if it's severe, somebody needs to look after the other children. Talk about it as a team.
Yeah. Plan. I'm a big fan of saying plan ahead. If you've planned ahead, you know everyone, and one person taking charge. I mean, again, this goes down to any sort of emergency. If one person who's in charge can say, can you please do this? Can you please do that? And we're doing this. So again, delegating so everybody else has a role and they know what they have to do. That team approach in a, I'm going to say, as calm a manner as possible is so valuable. If people panic, it ripples through the rest of the team. So again, as Tina said, if you've done that revision of your knowledge, if you're not putting your skills into practice, even that's just so valuable. It absolutely is. Can I just mention one other thing, Tina? I'm just thinking about people who are maybe in their own home and they're flying solo. Child starts to choke. They haven't got their phone immediately to hand. Now that presents a problem. I mean, I sometimes talk about, if you've got your phone's somewhere else, ask Siri to call 999. You can, maybe ask Alexa. I don't know if that's anybody's thought about that before. I don't know. Would that work?
Good idea. I actually don't know the answer.
Wondering that myself at the minute. I mean, I can yell at my phone to call 999. I did actually try it on a course, and I actually got through. Excellent.
I'd certainly be if it was a child choking and you didn't have your phone back immediately to hand, I'd certainly be shouting for help. That maybe possibly someone else either in the same building or next door will hear you. And the important thing is to get going. I would say with the technique, and if you can carry the child while you're doing that to the phone, then I would say with a small child you could do that. A lot of people are saying, can they have the videos? Yes, and I'm so happy that people want them. That really, really has made my day, because this is really what I want people to be doing, is engaging and making sure that they know what to do. We've had 2 questions, Jen, and I'm not sure I know the answer with the latest guidance, but it will be in the guidance, is how to cut apples.
Because they're hard, aren't they? That is a tough one to answer. Again, they've always got to be cut into that small lengthways, haven't they, to make sure that they're not chunky, so they're not going to get lodged, because they've got hard edges as well, so they really can get stuck at the back, can't they? So cutting them so they're just into not slithers, not the right word, but just into those sort of little batons, or just very small and lengthwise, so they've got little.
I think it is batons, and I think sorry, Jen, to cut over you, that is in the Eat Safe documentation, which you'll get that in the follow-up email tomorrow. It will tell you that we're going to get in touch. I will send you all of those links. Jen, if you just go to I'm so sorry, just go to the page after the questions. So some of the resources that we've used this evening are there, and we will, you can take a photo on your phone, but we will send all of these to you. I can say, first of all, thank you so much, Jen, for being here with us tonight and demonstrating and telling us everything about choking. Thank you, everyone, for attending. We really, really appreciate it. We'll hope you join our future webinars, and I will make sure that we send you everything that we've said that we will. Okay.